In this trial, we looked at healthcare utilization, cost, and outcomes for patients with metastatic colorectal cancer in two geographically similar regions, the Western Washington and British Columbia. What we found was that, in general, cost of chemotherapy was significantly higher in Western Washington than it was in British Columbia. And despite these differences in cost, outcomes were similar between the two groups.
It's intriguing that the Canadian treatment regimen, the recipe that was used to treat patients there, included an expensive drug, bevacizumab, also known as Avastin, whereas it did not include that in the United States, so that you would have thought that the cost of the Canadian drugs would have been higher, but presumably they weren't.
But the 5-FU and the oxaliplatin are all generic drugs, and even there, we see the United States essentially paying higher prices for drugs for which there is no pharma support, there is no pharma lobbying, but we're still paying higher prices because the degree of controls that we have over pricing in this country is essentially non-existent.
We don't know what the cost of clinic time, nursing time, all the laboratory testing, all of the ancillary things that go into the final bottom line of what it costs to be treated for colon cancer.
Labor costs and higher capitalization, of hospitals and the things that we are putting into hospitals, and the higher prices that we pay on average for even the basic drugs in the United States than anybody else pays. So again, I don't think this study doesn't lead us to an oncology solution or to an aha moment in oncology. It leads us to, unfortunately, what has been said by health economists for 30 years in the United States that have done these cross-country comparisons, and it always comes down to the same thing. It is, we are paying more and getting the equivalent or less outcome for what we pay in the United States than anybody else.